Now, as government scrambles to step up its vaccination drive, a COVID-19 fourth wave could be on its way. Only 3 million South Africans are fully vaccinated. The Health Department's Nicholas Crisp says that the timing of the first 3 waves could mean we could be in for another around October and November. Well, how likely is this, and how can we really focus accurately and be sure about the next wave, if at all it will happen? Let's discuss this now with National Institute of Communicable Diseases, Professor Adrian Puren. Prof, good afternoon. Welcome to the Midday View on eNCA. Firstly, is a fourth wave a certainty?
Well, it's the likelihood, what that fourth wave would look like in terms of what we are currently experiencing, as well as the vaccine rollout, I think will really determine what further resurgences will certainly take shape. As you know, when we looked at the second compared to the third, we knew that it would look substantially different, and it did, certainly in terms of certain other provinces like Gauteng, whereas in other provinces it's still, as you know, still ongoing, and not to the same extent as, for example, the second resurgence. And of course, what affected that third resurgence was the Delta variant. So I think it's all those particular factors. In other words, our ability to maintain the non-pharmaceutical interventions, the presence of the vaccine and the extent of that particular coverage, the circulating variants. These are all factors that will certainly play a role as to what that fourth resurgence will look like.
So a fourth wave is likely, but what it would look like, we don't know yet. So the more people get vaccinated, it might look different than if less people were vaccinated at a particular point in time.
Absolutely. So even if there were a fourth wave or resurgence, certainly the program at that particular point, if it does happen, let's say in October or November, we should really be at the peak of our, at least approaching the peaks of our vaccination, and that will certainly have a marked influence on how that resurgence would look like. We saw that in the UK and the United States. I know things are looking a bit different in the United States now, but when they actually rolled out their vaccine program amidst a resurgence, it was quite effective. And Israel was another good example of that. By rolling out massive vaccine campaigns, you can certainly limit the transmission and make that fourth resurgence look very different.
And a fourth resurgence, if and when it happens, could also be influenced by what variants are at play. I mean, nobody saw the impact of the Delta variant, the way it's ravaged the whole world.
Absolutely, and we were also, in a way, not caught short, but we certainly were aware of the second resurgence as well. We saw the Beta variant, for example, come along, and that certainly markedly affected what we experienced. And this particular resurgence, you're quite right, has really been dominated by Delta. In fact, worldwide, you're quite right, when you look at the United States and other parts of the world, the Delta variant has certainly played a dominant role. But that means that we have to have ongoing surveillance, because again, we could certainly have variants coming along. We will always have variants. I think it's the variants that are critical in terms of transmissibility, pathogenicity, as well as immune evasion, for example. So those are the sort of key characteristics that we are keeping watch on, and those will determine what, for example, that resurgence could look like, and our response to it.
Yeah, like we've had with a certain variants that just come and they don't cause too much trouble, but then you find that one, that's a variant on steroids, like Delta.
Absolutely. So Delta, if you look at our numbers, especially in Gauteng, and interestingly, KwaZulu-Natal, I think it would be interesting to see. We know that the Delta variant is certainly dominant there, the Western Cape as well. But yet, when we look at the pattern in KZN, what is that telling us compared to, for example, Gauteng? And again, you're quite right, in terms of so-called community immunity, to what extent is that playing a role?
What's that number? What's that number for us, Prof? What's that number of what would be a good level for population immunity in South Africa? What number is it? How many people? We're about 60 million. I mean, I don't know the exact number currently of our total population.
So again, we're primarily looking at adults, so it's about 2/3 of the adult population. If that particular, and again, that was under particular conditions when we had the beta variant. With the Delta variant, that number will probably be about 80% in terms of coverage, for example, if we were really to try and minimize the transmission as best as possible. But again, people are talking not just simply about herd immunity, but how do we adapt to this virus that, if it's going to be present with us for several decades, like the other cold viruses are, which are also coronaviruses, we will probably have to adapt, and therefore immunizations will certainly still play a critical role.
And our behavior. I mean, and we're battling to adapt. I'm hearing people talking about mask fatigue. I'm saying, how can you talk of a mask fatigue when we're in the middle of the deadliest pandemic we've seen in the world in 100 years? I mean, how can you be tired of protecting yourself? But the point now is, if there's going to be another wave, or as you said, another resurgence, its impact or intensity or severity will depend on how we behave, and also on the levels of population immunity, which should be about 80% of South Africa's adult population, which is into tens of millions. The rate at which we're going now, from your view of vaccination, Gauteng is ramping up, and the rate at which the government has gone to access vaccines, and also to localize some of the production of the vaccines, you know, as we have seen. Surely that should stand the country in good stead?
I think so. I think that we are on a trajectory in terms of coverage. However, it's also really critical to maintain the confidence of people, as you quite rightly speak about mask fatigue. Again, that's not a term I've come across, but it's an interesting one. But it's really a critical one. So in other words, we need to make sure that people are aware of the vaccines, about the safety, what it does. In other words, it prevents severe disease, hospitalizations, and possibly death. And again, I think the evidence will come through in South Africa when we start looking at who's ending up in our hospitals, you know, the vaccinated and the unvaccinated. And I guess that should, I hope, spur people to actually get those vaccines. And I guess those people who are receiving 2 doses, again, to get those 2 doses, because, again, we have good evidence in the Delta variant that 2 doses of the vaccine, of the Pfizer vaccine at least, will be critical. I know that there is discussion around adding so-called boosters or combinations of vaccines, the Johnson & Johnson plus Pfizer. And I think once the peer reviews are in, then those types of decisions will also
How long will they
contribute,
take? I mean, how long will those peer reviews come through? I'm asking this because just the other day I was reading an article written in the New York Times talking to some researchers from the CDC in America, and they were saying the plus minus 6 months, they're not sure if after the second dose of Pfizer, for example, what happens after 6 months. Maybe in that 6-month period, you should get the booster. When will the peer reviews come through with some certainty?
Well, I think fairly soon. I wish I could say definitively when that will happen, but I'm sure that there will certainly be pre-releases either through the companies and/or research organizations, or FDA and CDC will certainly contribute to that. And I think evidence from the UK as well will certainly contribute to that, because I think they're also doing some combination studies in terms of, say, AstraZeneca versus Pfizer, and provide that type of evidence, yes.
Yeah, I think people shouldn't think, oh, yes, another one, booster vaccine. I mean, I remember with my children, I got 4 kids, they went through their normal vaccinations, measles and polio, whatever, the concoction they give to babies and stuff like that. And then just before they started school, when they were about 5, 6 years old, they had to go for their booster jab. So it's not abnormal for us to get booster jabs for viral infections.
Absolutely, you're quite right. I think we focus a lot on adults now, obviously, because that's the target group. But you're quite right. Children go through these particular cycles of having boosters because they really are required. And similarly, when we had the flu influenza vaccine available, we each year would have to go for an influenza vaccine because there are updates around that. And something similar may well happen with coronaviruses, such as SARS-CoV-2. Yes, absolutely.
Yeah, I saw Professor Shabir Mahdi earlier talking to one of my colleagues saying currently the country can't afford a booster vaccine because we haven't even vaccinated enough people. So we need to focus on getting as many people as possible to that second dose of Pfizer or that jab of Johnson & Johnson as we get them. And that makes logic. That's perfectly understandable. But now, Prof, for you, I mean, as a scientist, if there was one thing that we really as a country had to focus on majorly ahead of October, November, where a possible fourth resurgence or spike of this deadly virus could take place in our country between now and then. I mean, we are now slowly edging out of winter, beginning to get into spring slowly. The hay fever season is beckoning very shortly. What would that one thing be? I mean, if Matamela Cyril Ramaphosa called you and said, it's a president here, Prof, what should I focus on? What would you tell him?
Well, you mean other than the vaccine rollout, I think is going to be the critical part in this particular program. I know we focused on the non-pharmaceutical interventions, and that's not going to go away. So again, my sense would be if we really want to ensure that we can get through the fourth resurgence as well, and I think getting those non-pharmaceutical interventions may well play a critical role. I think it's been highly challenging, and I know that the vaccine will certainly play a deciding and an important role, but I think the non-pharmaceutical interventions are here with us even through that fourth wave.
Yeah, it's important for us to do that and get vaccinated. And thank you very much, Professor Adrian Puren, some of the insights there with the talk now that as we head towards October, November, we could have another resurgence, and that will be classified as a fourth wave. But its severity, its intensity, its seriousness will depend what happens between now and then in terms of vaccinations. Please do go out and get vaccinated. If you're not sure, inform yourself, get the knowledge and understand, because it could really help. It will help all of us and help the country as well. Plus, as Professor Adrian Puren, that basic stuff. Wear your mask, sanitize, wash your hands, stay away from gatherings. Please keep safe.